Post-op instructions. Your pet has undergone a procedure that required general anesthesia. The staff at your veterinary hospital has ensured that your pet has recovered safely from anesthesia. Because some of the anesthetic effects take longer to wear off, you will need to monitor your pet closely at home until complete recovery. When your pet arrives at home, you may offer a small amount of water. Do not allow your pet to drink too much as it may cause stomach upset. Wait a few hours before offering your pet a small meal. If there is no stomach upset after a couple of hours, then you may offer a small amount more. Regular feeding should resume the following day. Depending on the type of surgery your pet had, specific exercise restrictions may be recommended. To decrease complications after surgery, your pet needs to be rested for the next 2 weeks. By resting, this means short, leashed walks only, no running or jumping. Excess activity may cause incisions to break down and result in healing difficulties. Your pet's incision needs to be monitored 2 to 3 times daily. Sutures may be placed in the skin that you can see, or the sutures may be under the skin where you cannot see them. Monitor the incision for redness, warmth, discharge, lost sutures, openings in the wound, and swellings. A small degree of redness and swelling is normal the first day or 2 following surgery. Your veterinarian staff will show you your pet's incision before you leave the hospital. Keep your pet's incision clean to avoid infection and irritation. To clean the incision, use a wet cloth to clean the area. Do not use soap or hydrogen peroxide as they may interfere with the healing process. Do not allow your pet to lick the incision. Licking causes sutures to loosen and may create inflammation and infection. If your pet is licking the incision, call your veterinarian's office for your pet to be fit with a collar to prevent licking. If your pet has sutures in the skin, you will be informed of a time to return for removal. Do not attempt to remove sutures at home. Some surgeries require placement of a bandage or dressing over the wound. Your veterinarian will inform you of how often the dressings need to be changed. The dressing needs to remain clean and dry to avoid infection. If the dressing becomes soiled or comes off, contact your veterinarian's office for a replacement as soon as possible. During the healing process, do not bathe your pet unless you have been given specific directions to do so by your veterinarian. Once the sutures in the skin are removed, you may bathe your pet if desired. Any medications prescribed by your veterinarian should be administered as directed. Complete the entire course of the recommended treatment to avoid complications. If during the recovery period your pet experiences any of the following, you need to call your veterinarian. 1. Lack of an appetite after 24 hours. 2. Any vomiting or diarrhea. 3. Worsening of condition. 4. Pain not controlled. 5. Incision opens, becomes inflamed, or develops a discharge. Be sure to ask your trusted veterinary staff if you have any questions or concerns about your pet's condition. Your pet's comfort is our priority.